All right, good afternoon, everyone. Thank you. We're 3 minutes past the hour. Sorry, we had to do a quick link change. Thank you for joining us for the July monthly provider meeting. We'll quickly go around the room and do introductions, and then we will start proceeding through the updated agenda. So, Michelle Frye, State Director.
Hi, Hurley Davis, Chief Administrative Officer.
Hi, Lori Manis, Associate State Director of Policy.
Nancy Rumbaugh, Interim CFO.
Ann Dalton, Director of Quality Management.
And Janet Priest, Associate State Director of Operations.
All right, so with that, I see that we have Margaret with us, and we will pass it to her for the HHS updates.
Thank you, Director Frye. Let me, as usual, check and see if my audio is okay.
We can hear you.
Great, thank you. Thank you again for the opportunity to provide a brief update from Department of Health and Human Services. As many of you are aware, the federally declared public health emergency, or PHE, was recently extended by the U.S. Department of Health and Human Services. So we received notification of that extension that currently extends the public health emergency through, I believe, October 13th through mid-October. So it is an additional 90 days. Those declarations can only be made for up to 90-day periods, and thereafter our federal counterparts review status and make a determination as to whether to extend further the federally declared public health emergency. What that means is that our flexibilities that are currently in place for services through temporary authorities do remain in place. And so all of the flexibilities currently in place under the Appendix K temporary authority do continue on and remain in place. We continue to receive information from CMS on a regular basis and have been engaged heavily with full review and identification of all flexibilities and our intended unwinding of those. So we do intend to communicate well in advance of the end of the PHE what we will be doing with those flexibilities that have been in place throughout the public health emergency. So again, it has been extended. We continue to work collectively on plans for after the end of the PHE and those flexibilities, but did want to give that update. Also, we have established a provider work group. This is a small size work group that is helping to inform some of our activities for the American Rescue Act plan funding. This is the funding that is specifically geared toward home and community-based services. It allows states to retain an enhanced federal matching percentage for a distinct period of time. And then thereafter, between that period of time and March of 2025 to reinvest those funds. So this provider work group represents a cross section of different service types, different provider types, and we'll be meeting again next Monday on August 1st. So that will be our opportunity to check back in with that provider work group with part of our agenda being how we intend to approach methodologies related to staff retention. So in addition to all of the work that we have done through our waiver renewals, our waiver amendments, and associated rate increases, we also recognize the need to address staff retention efforts for the providers and the direct care workers. So that work group will be coming in on Monday for our second session to review and give input on our intended approaches with regard to one-time payments for staff retention. Our focus is making sure that we are mindful in how we approach this funding, and that we have mitigation of any possible unintended consequences, because what we really want to do is enhance staff retention efforts and not create any unintended consequences, as I said, with those actions. So that work group is coming in on Monday. Also, for updates, we have received approval from the Centers for Medicare and Medicaid Services related to our community supports waiver renewal. That waiver renewal was approved by CMS. That is the that allows for an additional 5-year time period for that renewal approval. So we were very glad to see that. That brings forward many of the changes that were implemented in the IDRD renewal and were put in place on a temporary basis until such time as we could complete the full renewal. So we're very happy to have gained that approval. Also, we received approval from CMS for the amendments that we submitted for the HASKI waiver. That again brings forward changes that were put into place in the IDRD renewal and that we put under a temporary authority for HASKI to ensure continuity of both services, service definitions, and rates. So we have gained final approval for the HASKI amendment. And last but not least, we are continuing to work on the implementation of the 3% cost of living increase and staff bonuses that were granted by the General Assembly. Our Division of Ancillary Reimbursements is working on those calculations. Mr. Saxon was not able to join us this afternoon, but did let me know that that is on his docket for this week to try to finalize the COLA and bonus increases. So please know that we are hard at work with what that looks like in terms of implementation. With that, those are my main updates. I will stop and see if we have any questions. Okay, I see a question asking if providers can get a copy of the CMS approved plan. If you could further clarify the question, if that is the American Rescue Plan Act spending plan or the actual waiver amendments. In either respect, yes, those are available, and I'm happy to put links to that in the chat.
Margaret, we are also working on getting the ID renewal has already been uploaded to the waiver manual on the DDSN website. And we got copies on, I think it was Wednesday of last week, of the HASKI amendment and the CS renewal. And we're currently working to get those updated within the manuals on the DDSN website.
Great, thank you. I should have mentioned that I don't know that I can put it in the chat, but Lori, I will send also a link to the American Rescue Plan Act and the public facing website that has that information, if you would be so kind as to share that as well.
Absolutely, we'll get those sent out.
Okay, I see a question on approval of single case agreements. We do have several that have been approved and finalized. Those final executed contracts or agreements, excuse me, should be coming out. We do have 2 that are still pending with HHS. So we'll be sure to follow up with those individuals if they are still pending with us to give you an update on that. I have a statement that there was some difficulty with the audio. So the extension of the public health emergency, I'll just reiterate, that was extended by the Federal Department of Health and Human Services. So the current 90-day period runs through mid-October, and that does extend the flexibilities that are in place under the Appendix K through at least mid-October. Also, with regard to staff retention and recruitment, again, my reference there was the Enhanced American Rescue Plan Act funding. It does reflect the capacity of states to receive enhanced funding and then thereafter reinvest that for approved activities that are designated in the spending plan. So that was the reference there. All of the, I have another question. All of the appendices K are listed on the DHHS website. If you go to our website, it is listed under the section where we have all COVID-19 related guidance. So all of the approved Appendix Ks are located there on our website. All right, I do not see any further open questions. So thank you very much. I appreciate your time.
Thank you, Nancy.
Okay. The next item is about attended care and in-home support rates. They were increased as of January 1, 2022. And it came to our attention that we needed to raise the rates for our self-directed. We've contacted Charles Lee Center fiscal agent. Payrolls have already been corrected as of July 10th. And retro pays will be made from January 1 through July 9th. And those probably should be a lump sum payment that would come out. Do we have any questions?
So far, I don't think so. And I think we can move to your agenda item. If we get questions, we'll come back to you after Ann goes.
Sure.
Oh, wait a second. Evelyn says repeat the date for retro pay. So Evelyn, the retro pay is back to January 1, which corresponds with the waiver renewal and the amendments that were done to increase the rates on the January 1 go live date. So those workers will get their pay retro to January 1.
Okay, so as somewhat of a standing agenda item, I wanted to remind everyone to please be sure that you are monitoring your incident management reports. As a reminder, the Risk Management Committee should be meeting on a quarterly basis, and this is an excellent opportunity for the providers to review both the type and frequency of their A&E allegations, their critical incident reports, the people involved, the need for additional support, and all of the relevant details, and also monitor their compliance with timelines required for reporting at both the initial stage and the final report. We are continuing our work with the Department of Health and Human Services regarding our OIG follow-up and our agency's corrective actions related to the OIG audit. And I will be in contact with providers after reviewing the past quarter's worth of data and looking at timeliness issues with reports for allegations of abuse, neglect, and exploitation in critical incidents. Please let me know if you have questions, but please work with your staff to make sure that they are reporting on time. Thank you.
Okay, I think I'm next on the agenda. We don't have any questions right now. We'll come back to it if we need to. The first thing I wanted to do is give you guys an update on the ISP billing functionality in their app. We had initially projected a go live date of August 1st. That is going to be delayed for a little bit of time. Those of you who have had trouble with it know that there has been kind of a glitch in the Therapp system related to total units and the way that the system calculates total units in authorizations. Therapp kind of stopped working with ISP billing and really tried to start working on correcting that problem because it was blocking billing for providers, and it was requiring providers to, it was requiring DDSN to create overlapping authorizations, which is causing all kind of trouble. The other thing about overlapping authorizations is that it can't exist with ISP billing. So the good news is they're put in some new functionality over the weekend to allow certain approval roles to be able to update that total units field so that we can get to the point where we don't have any overlapping authorizations. The trick is, in order to get to ISP billing, we got to go back and correct all the overlaps that we had before and kind of put in this functionality to stop the ability for overlapping auths. So I say all of that to say it's not been thrown to the wayside. We absolutely intend to move to ISP billing. As I told you guys last time, the first rollout will be in the 15-minute unit services of individual employment and SLP1, and then we'll move towards ISP billing for the half-day units and the full-day services. But we're going to delay it just a little while so we can get the system working the way that it needs to in order to support that billing. All right, I don't have, let's see if I have any questions. Yeah, so the prorating billing authorization issue is exactly what I was talking about. Dana, I have a question about an update on the waiver case management billing prorating. So the prorating will still happen, but if you have an issue with billing, there's a pretty easy fix. You just have to send an email in and we can fix it for you, right? So that's the functionality that I told you they're at deployed this weekend. So if you have an issue with billing because an authorization prorated for partial month, right? And the system is blocking you from billing, you just need to send an email. Right now you can send it to me and Jennifer Jakes. We are gonna come up with kind of an email box that people can send those to, and we can update your total units and fix both authorizations. Just wanted to put out there to the providers that there are several policy directives that are currently out for public comment. And we, particularly on the residential need policy, which is brand new, we really want to encourage providers to review that directive carefully and comment on it so that it can help us make sure that we implement it the way that it needs to and so that it will work. We want to make sure we didn't forget anything in the middle of it. So if you haven't already, I think the public comment on that directive closes next Friday. Please make sure that you go out and look at it. Particularly case management providers need to take a look at that policy directive because there's a lot of stuff in it that involves case management that didn't before in the process of residential moves and assessing for residential need. So I just want to make sure that providers really get out and take a look at that. The next item on the agenda is just to piggyback on what Margaret said about the waiver renewals and the amendments. The IDRD waiver renewal has been approved for a while now. And at this point, the Haskell amendment and the CS renewal that kind of brings all three waivers in line have also been approved. So there are a few new services that we're working on implementing that are in some of the waivers. You know, sometimes they're in more than one, sometimes they're in just one. but be on the lookout for information related to remote supports, independent living skills. There's a service that we'll be trying to implement that is kind of group respite rates for children who live in the same household. So those are kind of some things on the horizon. The other thing is that the performance measures in all of the waivers have been completely reworked. So providers are going to start to see a change in the oversight and the way that DDSN kind of reviews and reports on the services that are being delivered through the waivers by your agencies. Lastly, one of the changes that actually CMS made, we didn't, to level of care reevaluations, is the requirement that the state agency be the approver of all levels of care, including reevaluations. Right now, levels of care are completed by case managers and approved by supervisors at the provider locations. The change will be the levels of care will continue to be completed by the case managers, but the approval will have to happen at the state level. So it'll be done kind of out of the eligibility division. So we're going to be really working on trying to staff up and be ready to do that. We don't have a target date, but I really wanted to let you guys know that's been in the renewals from the beginning, but I wasn't sure if people had really seen it and paid attention to it. But we will be posting positions for level of care reviewers, as that's kind of a new big task. It will be all 3 waivers. So even the HASKI waiver where the NF level of care is completed by the case manager, it will have to be staffed with somebody here. Again, that's not effective immediately. I just wanted to let you know it was coming, and let you know that's why there's going to be a good number of positions posted pretty soon on our end. I have a question about how will that change if the level of care is not approved timely or approved incorrectly, as providers will not be paid correctly. So the case managers will still be responsible for completing them in a timely manner. We're going to work through some policy requirements about timeliness of completion. DDSN and the waiver policy has always recommended that levels of care be done 30 days ahead of time. We're probably going to need to really work through making sure that that case managers get them done, in plenty of time so they don't go out of date. We obviously will be monitoring it as well. So I don't think there'll be any real change to that. The positions will all be in the eligibility or HASKI division. So there's a question about the new fixed price bid renewal application. So we're really working through some of that right now. I think you guys are going to see that that process change pretty significantly as we move forward. We're hoping to be able to fully streamline it so that we do some kind of qualifications process. So we don't really have a timeline on that right now. I think that's all of the questions for me. So I'm going to turn it over to Harley. You want to talk through upcoming events? Sure. And then we'll take questions.
Just briefly, would like to mention that a memo will be coming out likely this afternoon requesting nominations from DSM boards for the Golden Palmetto Award. So our timeline's a little bit different for the award this year, but we wanted to get it in before the end of 2022 to recognize those counties from 2021 that are nominated by the boards across the state. So just be on the lookout for that and instructions for how to nominate a county and what information is necessary to be provided. All those instructions will be in the memo and it'll be coming out soon. I also wanted to mention that the Life with Brain Injury Conference is this Thursday and Friday, the 28th and 29th, hosted by the Brain Injury Association of South Carolina. So please attend if you are available. That's all for me. Thank you.
So somebody just let me know that I skipped over a whole agenda item of mine on the agenda, so I apologize for that. The residential leave report, it will go out soon, probably in the next couple of days. I apologize that it's a little bit later than normal. That's a report that I have to run at the state level and then do a bunch of magic to it and then break it all up to get it sent out to you guys individually. So hopefully we can get that out to you like in the next couple of days. A couple of reminders about that residential leave report. If you are not billing through TheraP, or if you have not submitted claims through TheraP, it is not picking up your leave. It is only picking up billed leave, not leave that is in attendance. So I just want to caution you about that when you get it, because it gives you kind of a total number of leave taken, how much the person has approved, how much is left. Don't think that you have more than you do. Like if you haven't hit the submit button yet, it really is only calculating on that. So again, that you should get that no later than the end of the week. All right, do we have any other questions from providers? I don't see any more that need public reply. There's a couple questions about who do you contact with finance questions. Nancy Rumbaugh is our current interim CFO. I thought that had already been announced, but you guys can contact Nancy if you have any questions. I don't see anything else. Anybody here have any additional? I think we're good.
Thank you, everyone. We look forward to having this same meeting next month.
Oh, I did. There is another question. Hold on, because this is a good one. I just found out last week that there was a problem with companion billing. And so I emailed HHS last week when a provider sent me a specific problem with, it was kind of a rejection based on limits in their system for companion. Those limits have been taken out, so you shouldn't have a problem. If you have companion claims that have rejected, please try to resubmit them. And if you get a rejection, email me directly, tell me what rejection you got, like what rejection code it was. But we think it's fixed. So thanks for answering that or asking that. So I should have thought to say something. All right. Thanks, guys.
Thanks, everyone.